My name is Dr. Crystal Tyson and I welcome you to my channel. Today I'm going to talk about chronic kidney disease, exactly what it is and why it's important to know whether or not you have it. Before I get started, I just want to point out that chronic kidney disease affects approximately 30 million Americans, which comes out to approximately 15% of the US population. To put it another way, 1 out of every 7 American adults have chronic kidney disease. And it's very important for us to know about this condition so that we can prevent it and treat it for those who have it. I see a lot of patients as a kidney specialist who have kidney problems, and one of the main things that they want to know when they see me quite naturally is exactly what is chronic kidney disease and what does it mean that I have it. So if a healthcare professional or a doctor has told you that you have chronic kidney disease, what we're basically saying is that we found evidence either on your blood work or on your urine studies that your kidneys aren't functioning properly, meaning your kidneys aren't filtering the blood as quickly as we believe that they should, or we found that there's damage to the kidneys based on you spilling extra protein or extra blood in your urine. So other terms that we use for chronic kidney disease or other ways that we tend to express this to patients is not only by saying that you have chronic kidney disease. You may have heard someone say that you have, quote, kidney problems, you have weak or failing kidneys, you have kidney damage, you have extra protein in your urine. There are a number of different ways that we communicate this, but what it all comes down to is that you have kidney damage, and we call it chronic because we believe it's been going on for a long period of time. We usually use about a 3-month period to determine whether or not the changes that have gone on in your kidneys are reversible or not. So basically, chronic kidney disease is long-term kidney disease that we believe is permanent and is not going to get any better. And our job from that point forward is to try to protect your kidneys as best we can, so that to reduce your chances of developing kidney failure in the future. Why is it important to know whether or not you have chronic kidney disease? Well, it's important to know this because people with chronic kidney disease have a higher risk of developing kidney failure. We can't live without our kidneys. So people who have kidney failure need to have some type of replacement. And that's either by receiving dialysis, by receiving a kidney transplant. And if they don't believe any of those 2 choices are appropriate for their life and their lifestyle, they may choose not to have anything done at all and we can help them be as comfortable as possible as they live out the rest of their life. But again, kidney failure either means you're going to die from kidney disease if we don't replace it with some type of treatment, and that's either a kidney transplant or with hemodialysis or peritoneal dialysis. Another reason it's important to know whether or not you have kidney disease is because people with kidney disease have a higher risk of complications from heart problems. So patients with kidney disease tend to have higher occurrences of heart attacks, irregular heart rhythms, and heart failure, and that can lead to a lot of medical complications and also premature death, meaning you can die earlier in life or prematurely in life because of these complications of kidney disease and from heart problems. It's also important to know whether or not you have chronic kidney disease because it can complicate the management of other conditions. Diabetes and high blood pressure are the 2 most common causes of kidney failure in the United States. And if you have either of those conditions, more than likely your doctor has prescribed you medications to treat you. If you have kidney disease, it limits exactly what types of medications we can use and how much of those medications we can use to control your condition. So kidney disease definitely impacts how your doctor is able to take care of other things. Kidney disease by itself can also cause complications, so that's another reason it's important to know whether or not you have it. Kidney disease can raise your blood pressure and cause hypertension by itself. Kidney disease can also make you have trouble getting rid of fluid from your body, and you can have trouble with swelling and building up with fluid on your lungs. Chronic kidney disease can also cause problems with anemia or low blood count. It can also cause electrolyte and mineral issues, so that patients tend to have issues with high potassium, high phosphorus, high amounts of acid in the blood that the kidneys aren't able to regulate on their own, and we typically have to prescribe medications to keep those processes in balance. So kidney disease is a huge deal. And you definitely need to know if you have it, especially if you have high blood pressure and especially if you have diabetes. So whenever you see your doctor, be sure to ask what the health of your kidneys, what the status of your kidney function is. Your kidneys can be evaluated with a simple blood test and a simple urine test, and it gives you a wealth of information. So definitely make sure that when you see your doctor next, that you ask them what the health of your kidneys are. I hope this video was helpful, and if you thought it was, be sure to click on the thumbs up button so that you can like the video. If you have any comments, feel free to leave them in the comment section below. And I'll also leave some links for some additional websites for you to visit to do a little bit more research on your own about kidney disease and what you can do to help control the condition. Thank you and take care.